Good morning. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Health Professionals Pathways Program, or HPPP, informational webinar. Before we begin, I'd like to discuss a few housekeeping items. First off, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. Today, the chat option will be open during our question and answer session, which was at the end of the webinar. At that time, please feel free to place your questions in the chat. The slide deck and all of the other links and information that you need can be found in the chat box, and we will link those several times so that you can find them. And with that, I'm thrilled to introduce our first presenter, Hovit Khosrovian, Acting Deputy Director at Health Workforce Development.
Good morning, everybody. Thank you for attending our webinar. Really appreciate it. My name is Hovit Khosrovian with HCAI, Office of Health Workforce Development. I am currently the Acting Deputy Director, and my regular job is Senior Policy Advisor for the office. So happy to go through these first few slides with everyone and kind of give an introduction to HCAI and Office of Health Workforce, and hand it off to the staff to do just an amazing job of giving you all the information today about our Health Professions Pathways program. So next slide, please. One more. So first few slides, which kind of want to set the baseline for HCAI, our health. And again, I'm trying not to use too many acronyms here today. So for the Healthcare Access and Information, Department of Healthcare Access and Information, and for those of you that have known us before as OSHPD in the past, the Office of Statewide Health Planning and Development, we've changed our name a couple of years ago when we grew up to be a department. But in general, our mission for our department is to provide equitable access to quality, affordable healthcare for all Californians. Through resilient facilities, actionable information, health workforce each community needs. So it's really a key mission of ours and goal, and it's what all our other offices kind of work together to get to. So it's really exciting. It's really a passion of a lot of the folks here that were working on these projects, and we're really excited to share more information with you today on them. Next slide. So kind of an overview, those of you that kind of know some of our history. So OSHPD, as we're called, or OSHPD, there's competing factions of how we pronounce it. So we got created in 1978 as then the Office of Statewide Health Planning and Development, with the goal of collecting data and ensuring healthcare was accessible for all Californians. So in 2021, we had a recast where we transitioned to now the Department of Healthcare Access and Information, and grew significantly in our scope and our work, particularly on the health workforce, where we had at least, say it is I don't want to minimize it, but it was at least 400% increase in our funding. Our growth of our programs were significant, and HCAI really became the health workforce focal point for the state. To help ensure that there's access all around, as well as other areas of the department that we're really excited about and happy to have join us, such as the Office of Healthcare Affordability that just recently was created through legislation, and our stalwart program, the Office of Facilities, which is now called OSHPD. It's a little trick on the words there to keep the name. So we were really excited in 2021 to grow and have all these different workforce programs get added on, and still getting added on. We're still growing and still getting new programs and additional funding from the legislature to really make a difference in California and to support the workforce and the pipeline. Next slide. So some of the objectives for health workforce development for our office is really to support and increase the health workforce. So we have three main goals within that. The primary one is to ensure that there's enough access for the medically underserved areas. And when we talk about medically underserved areas, we're talking about areas that have shortages of providers, areas that have needs for specific types of providers, whether that's, we go into primary care, oral health, behavioral health, which is a big focus of ours, allied health, and nursing. So we kind of run the full gamut of health professions, ensuring that we can provide enough support for these communities that need them the most. The other aspect is to really ensure there's equity and diversity in the workforce, and the workforce represents the communities they serve. We know through our data and analysis, there's quite a number of disparities in the workforce versus the population. So one of our goals is to really work on ensuring that there's access for those that need it, really providing a more equitable platform for those that want to get into health professions, and then those that want to access healthcare services from individuals that represent who they are and their communities. And then lastly, and obviously one of our biggest goals as well is to ensure that there's enough providers and health workforce for the Medi-Cal population. And those are our main three. You'll see that scattered throughout all our programs, those three main goals. So how we do that is through the three primary measures. One is to increase educational capacity. So we have a number of programs that expand the capacity at the schools and training programs to add more students, with a focus on those programs being equitable and accessible by all, even those that might not be able to afford the program. So we have different programs that we get into next with our individuals pursuing health careers. So as we expand programs and as we support individuals getting into health professions, we offer scholarships, loan payments, and stipends to really support individuals to come out debt-free or pay off their debt so they can be free to practice where they want to be able to provide services to those individuals in need. In some of those underserved communities, rural communities where it's difficult to get people to work there, we want to make sure they're not burdened by debt and they're able to support those communities. And then the other aspect is the pipeline. So for many years, we had a lot of loan payment scholarship programs, education capacity expansion programs, and pipeline was a small component, but since our recast, it's expanded quite a bit into that. Now what we have is the health professions program. And we're really excited about that because it's a real opportunity to kind of, we've always had the thought of, we add more education capacity, we offer more scholarships, but we aren't backfilling and we aren't supporting the back end of the educational system and of students having access to for health professions. So the pipeline is really the key focus there for us. I'm really excited about growing the pipeline. Next slide. So just a overview of the Health Professions Pathway Program. So this is our second cycle. We're really excited about it. And to kind of just give everyone a couple of bullets on the purpose of the program, it's to support and encourage underrepresented and disadvantaged individuals into pursuing health careers. And we want to focus again on culturally and linguistically competent health workforce. So we talk about having the underrepresented populations be represented in medicine, in healthcare, as well as being able to provide services that are like we said, culturally and linguistically competent to those communities that need them the most. And generally, that's what, when we talk about medically underserved areas, we see a lot of those communities needing culturally competent care, and it's a real big need for a lot of individuals, and we're trying to make an impact there. And then the second bullet is mainly the health and safety code section. This is where we get the statute of what the Health Professions Career Opportunity Program, which is the over-encompassing term that we use for our Health Professions Pathway and Pipelines programs. And then there it discusses supporting and encouraging underrepresented disadvantaged individuals into pursuing health careers. So that's really our key focus there. That's where a lot of the baseline comes from in this program. Next slide, please. So some of the goals that we have for the HPPP, so you hear these acronyms a lot, and hopefully those of you that have applied in the past for our programs are getting a little more familiar with it. Those of you that are new, apologize, you're probably gonna hear a lot of acronyms today. We're trying to do our best to explain them. So HPPP, as we call it for short, Health Professions Pathways Program. Our goals are, one, we have the statute that we like to follow, and a lot of that was worked on with the legislature and our office to make sure that we really were approaching this program to create the most equitable baseline for creating a workforce that represents the population they serve. So statute definitely is one of the guiding factors for us. Second is really supporting the organizations that are developing and creating these pathways for individuals. So one of the things we like to see is just different levels of education and support within the pipeline for individuals. And another goal is to inspire the students. So really, that's really the key there. I think is when we have these pipeline programs, is to have the students that are maybe the first time they're hearing about a specific profession. Maybe it's to they know about it, they just didn't know they could be potentially involved in this profession and even get a career in it. It's to build that just inspire them and build that sense. And then we also want to create different opportunities for the students. So we talked about having the partnerships there within the community, within the educational system, and within the actual employment system, so that there's there's a pathway, and there's a goal at the end for these students that are in these programs, that they know that if they participate, they have the ability to move forward and become a health professional. And then lastly is, again, to ensure as these students are accessing the pipeline and entering these programs, that that they're culturally and linguistically responsive to the individuals as well. And that's one of the key components you'll see in our program, is to ensure that what they learn, what they see, how they interact with others within some of these different opportunities, really helps grow that sense and helps them learn and prepare for a future in the health professionals in California. Next slide. And that's it for me. So I'm done. I don't know if Chris, want me to hand it back to you, or just go straight to Christian?
We're going to go straight to Christian Jones, policy analyst.
Hi, everyone. My name is Christian Jones. I'm a policy analyst here at HCAI, and I'm going to go through the key program elements and key dates for HPPP. Next slide, please. So first, what kind of programs are going to be eligible? So eligible programs must support pathways into these following healthcare professions. So primary care, behavioral health, geriatrics, nursing, oral health, or allied health. Next slide. We have 4 award categories for HPPP. They're split between pipeline programs, summer internships, post-undergraduate fellowships, and post-bachelor's degree scholarships. So your pipeline programs are going to be programs that help support and guide students into healthcare careers. And these programs will be present at colleges and health professions training programs. Summer internships are going to be programs that provide paid summer internships to people seeking careers in healthcare professions, as outlined in the previous slide. And these programs are going to be present at colleges, high schools, and school districts that are serving high school students, health professions training programs, CBOs, and community health centers. Award category C is going to be for programs that provide fellowships to people after they've gotten their undergraduate degree. These eligible organizations are going to be at four-year universities or colleges, the health professions training programs, CBOs, and community health center. Finally, award category D is for programs that provide scholarships for post-bachelor degree training or enrichment programs, and these are going to be provided by four-year universities. Next slide. So each award category has a maximum amount of money that you can receive through that category. For pipeline programs, the maximum is $500,000 annually, but you must be serving 240 students per academic year to receive any funding under category A. For category B, summer internships, the maximum is $5,000 per internship you provide, up to a maximum of 20 internships per year. For post-undergraduate fellowships, the maximum is $25,000 per fellowship, and 5 fellowships per academic year is the maximum that you can provide. I will note for everybody who is asking questions into the chat that we will have a Q&A at the end of the session that you can ask your questions to, and they will be answered if they're not already answered through the presentation that we provide. Next slide, please. So key dates. The application's already open. If you feel so inclined, you can start an application right after the webinar. The webinar's today. Congratulations, you made it. Thank you for being here. We enjoy having you here and providing this information to you. You must submit your applications by October 16th at 3 p.m. Any applications that people try to submit after that date won't be considered. We anticipate telling you whether you've received an award by mid-November, but that's we want to give leeway. Sometimes our target dates don't exactly get fulfilled due to some complications. We anticipate in mid-December to have our grants executed and grant agreements signed, and then these grants run 5 years to June 30th of 2028. And with that, I will pass this to Chris Polakaitis, sorry, our data analyst here at HCAI.
Good morning, everyone, and welcome. Today, we'll go to the next slide, please. Today, I'm going to be talking about evaluation and scoring procedures. When the application closes, HCAI will review each application for the presence or absence of any required information to conform with the application submission requirements. HCAI may reject applications that contain false or misleading information. HCAI will use evaluation criteria described in the grant guide to score each of the applications. Next slide, please. Let's talk about the scoring criteria. We have this in core categories, guideline, and the maximum points possible. I'm going to cover each one. What we look for is health profession shortage areas, or also known as HPPPs. We asked that the guideline is the applicant program. Does the applicant program take place in, our program site take place in a HPPP? The maximum points for this guideline is going to be 25. Diversity. The applicant's program is culturally or linguistically responsive to program participants. This is going to be worth 20 points. Priority health professions. Does the organization promote primary care, behavioral health, caring for older adults, and/or health careers? This question, again, will be worth 20 points. Student support. Does the program address the challenges specific to the target program participants and demographics? This guideline will be worth 20 points. Disadvantaged individuals from HPPPs. This is experience exposing economically and/or environmentally disadvantaged individuals from HPPPs to primary care, behavioral health, caring for older adults, and/or other health careers. Underserved group. The guideline is applicant supports individuals from certain underserved groups. This question will be worth 8 points. And finally, experience. Years of experience an organization has exposing underrepresented individuals to primary healthcare, behavioral health, caring for older adults, and/or other health careers. This will be worth 10 points. The combination of all of these will equal 118 points. Next slide, please. And now for the HPPP grant application process, I'd like to hand it over to Clinton Ramstad, Program Manager.
Good morning, everybody. My name is Clinton Ramstad. I'm the Program Manager over the top of HPPP. I'm going to do a brief overview of the application process itself. If you could, please, next slide. So this is the criteria that we're going to have in our application. There are a couple things I want to point out, though, that you may want to prepare for it ahead of time if you haven't started on an application yet. A key part is we're going to have 3 to 4 qualitative questions in there. Basically, we're looking for a paragraph or so for each one of these, 1,000-character limit. So if you want to go ahead and write one or work on one ahead of time, you can copy it and paste it right into the application. It'll work. It'll be fine. Also, too, there's program budget information. I would advise you to take a look at our grant guide and look at the program budget information and try and think about how you want to allocate your funding before you go in the application itself, because there's a lot of questions that'll be about budgeting. Now, keep in mind, when you're in the application, too, it saves as you go between pages, but you don't want to necessarily spend too much time on one individual page. The budget is where you can experience that type of situation. So you may want to think about that ahead of time before you jump into the application. Also, too, we are working on a technical assistance guide, and we're going to get that up on the website in the next few days. Next slide, please. This is an example of the budget and how it would look like. This was actually taken out of our grant guide, so we put it in the presentation so you have an idea of what it might look like. And so this is something to think about as you're filling out your application. A little bit of advanced preparation will make that application process go through a little bit smoother for you. So that's why I've posted an example in here into this presentation. Next slide, please. This is a key area we always have to talk about in our presentations. When you're going through in your application, you want to be careful, especially when you get to the contract administration page on it. the name of your organization it needs to correspond with what you're reporting to the IRS. Because we all, we have to report our expenses out. And so it has to match up. If it doesn't match, then what will happen is it'll cause a delay in either us executing a grant agreement or in paying you. And if you're in a situation where you have you need to get paid at an address different from what the address you're using with the IRS, we also offer you in the application a chance to complete an STD 205. So it's built into the application, and it's a lot easier than how things were in the past. Next slide, please. And I'm going to hand off the presentation to Christopher. So thank you so much, and I appreciate your time.
All right, thank you so much, Clinton. As you can see, the team has worked really hard to put together this program, and we're going to transition to our question and answer session now. The chat option has been open, and we've been receiving your questions. We're going to go through these questions in the order that they have been received, and we will do our best to answer all the questions you have. So starting out, we will start with Emily's first question here. What are the terms of a summer internship? Is this flexible? The organization I represent works with schools, so summer starts and ends early. And we're going to, Clinton, are you able to answer that question?
Well, the best I can offer though is right now to refer to the grant guide. The terms there that could mean a lot of stuff. If you have a very specific question, I would strongly recommend you send an email to the HPPP mailbox, and we'll be happy to take a look at it and answer it. If it's something out, especially if it's something outside the lines of what we're offering in our grant guide.
All right, thank you. Sharon asks, what's the definition, or what is your definition of allied health? Is that also you?
Well, we offer the term also in the grant guide, but the definition, though, it probably needs to be defined by a policy analyst.
Okay. Policy, you want to speak to that? Chris or Christian, would that be you guys on the answer for that?
I think Hovik would be the one that I would pivot to for that question.
Okay.
No, it's more than likely defined in the grant guide.
Yeah, I could say if it is in the grant guide, that's great. It's also allied. It's a kind of a general term. I think one area that might help folks is we have an allied health scholarship and loan payment program. I would refer to the scholarship with loan payments a little different. That has the listing of allied health professions. And I think with this program with the HPPP, we're not trying to be too specific on defining allied health, because I think if everyone looks up allied health, you get different definitions. The federal government has a different definition. Different programs have different ones. So we try to keep it broad, and as long as it's focused on health care and the health professions, allied health generally is a pretty broad term. But as a guide, you could we do have our grant guides on our allied health scholarship that might be of assistance. And yeah, I don't know if the program team or grants team knows if we do have a listing on the grant guide or not. I guess unfortunately I can't remember if we do or not. But if we do, great. If we don't, then I would let everyone know, just refer to some of our allied health programs on our website, and I'm sure that we could probably put a link in here for that. That'll help give you a little better definition. But generally, allied health for us, more or less, in really basic terms, is individuals that are either at the certificate level or pre-bachelor's level, or in some cases there are bachelor's level, but it's generally non-graduate. I guess it's probably an easy way to say it, non-graduate health professions.
All right, thank you, Hovik. Melanie asks, for Part A and B, does the pipeline include master's students, for example, MSW, MPH, or MA and MS degrees? Clinton, is that a question you can answer?
I'm not offhand. This is also where I would look to policy to define. Whereas definitions and stuff, that's usually the case. I'm looking in the grant guide. If you could, I don't have an answer right off the cuff. So I mean, if you could please send a question to the HPCOP mailbox, and we'll do our best to get you a straight answer, a good, reliable answer.
All right. Jennifer Luna asks, we have private for-profit certified nursing assistant training programs. Will we qualify for category A? Is that who wants to answer that one? Christian Hovick.
Chris, sorry, which question are you on?
We have a private for-profit certified nursing assistant training program. Would we qualify for category A?
Pipeline.
Chris, I have added in Ann Powell to answer some colleagues' questions.
Yeah, go for it.
Okay.
Thank you.
Thank you. So I'm looking at the questions, and I want to get to where we're at in the list. So bear with me for a moment. So yes, the PowerPoint will be available online, and a recording will be posted. In terms of ABA therapists and BCBAs, those are considered behavioral health professions. So yes, they would apply. Tell me if I'm missing questions.
And we're on question from Jennifer Luna. We have a private for-profit certified nursing assistant training program. Would we qualify for category A?
Traditionally, we do not fund for-profit entities, but we'll need to go back, but to see if that provision was in the contract, the grant agreement. But that is our standard policy.
All right, thank you, Anne. Apple asks, how does one get assigned a health professions training program? How does one get assigned as a health professions training program?
So traditionally, the program is not an assignment. You present yourself as a health professions training program in your application.
All right. Emily asks, how many awards were made in cohort 1 and what was the breakdown?
Clinton, I don't know if we have data from the first cycle. If not, we can post that information and respond to you offline.
Yeah, I apologize. We do have the information, but I don't have it readily available at my fingertips at the moment. Yeah.
Yeah. So Emily, if you would send an email to, is it H3P at?
I put it in the chat.
Perfect.
The
Thank
award
you.
notices for last cycle.
That's great. I've already
All right.
talked. Go ahead.
All right, Cedras, how do I download this PowerPoint? We do have links posted in the chat, and then also it will be on our website. So we'll have that posted, the link in the chat as well for that. Next question, does your definition of behavioral health include ABA therapists and BCBAs?
And I answered that. Yes,
Yep,
they do.
good. Alex asks, does the application have a preferred method of confirming HPSA status? Does the applicant have to be physically located in a HPSA, or do participants have to reside or be placed in a HPSA, or both?
HPPP designation falls to the organization applicant. Sorry, Paul, or Chris.
No, I was just going to say it's dependent on the program site. Where the program site takes place.
Yep. What is the hour requirements for a summer internship?
If you do not find that in the grant guide, please send us an email and we will research that and get back to you.
Are all budget categories available or just one that corresponds to A through D?
Yes, they all fall into A through D. And as you'll notice in the sample budget that was presented by Clinton, there is a line that is specific to category A, but otherwise they apply to all.
All right, thank you, Anne. Michelle asks, how does this apply to high school CTE programs? Are our students eligible for the $5,000 summer internship funding?
I would think so. As just for people to know, it's a CTE, I believe, stands for Career and Technical Assistant or Education. And that would certainly align with people intending to go on an allied health path where they get experience while they're in high school. And that would apply.
All right. Does behavioral health criteria include MFT and MSW?
It falls to whatever category you're funding, you're seeking funds in, and I believe it's the post-baccalaureate is what would be considered advanced degrees, not before then.
All right, thank you, Anne. Next question is, are 501c3 eligible to apply?
Yes, definitely.
All right. What are you defining as the academic year?
Traditionally, academic years run from August through June. We recognize it may be a month or so earlier or later on those dates, but that's the traditional academic year we recognize.
All right. Does HCAI provide tools for mapping the locations of educationally or economically disadvantaged areas, or for mapping rural and frontier areas?
I can answer this. HCAI has the tools. There's nothing that the applicant will need to do for this. HCAI has the tools to do this.
Thank you, Chris. Does a registered healthcare apprenticeship program for direct care occupations eligible to apply?
We will need to do some research to answer your question accurately. So please email us your question and we will respond.
All right, Maria, please email the HPPP at hci.ca.gov, and we'll get that question clarified for you. Finally asks, is there a technical support / help desk for computer challenges?
I can answer that. This is Clinton. If you run into a problem, you know, and this does happen, please send us an email. We're happy to help you. We do help people with their navigation challenges as they're going through an application. Also, too, we're going to be releasing a technical assistance guide in the next few days. So if you want to keep an eye on the website, technical assistance guide is going to go by page by page by page, helping you navigate through your application. So it'll be a wonderful resource.
And we will send an email out to all registrants of the webinar with the recording link, as well as that technical assistance guide and all of the other resources. So by registering, you will receive an email with all of that information once we have it all available. Thank you, Clinton. Next question. If we fit into 2 award categories, do we apply separately or together?
This is Clinton again. I will answer that. You will create one profile as a user, okay, as a program director. But when you go through and complete an application, let's say you apply for category A, you'll need to complete one application for that and then go back again and apply for category B. So it'll be basically two separate applications, but they'll be grouped together underneath your name or your organization.
All right, thank you, Clinton. Can you please review the list of eligible entities?
We'll refer you to the slide deck that will be posted, and on a slides 12 and 13 that is articulated as to the eligible organizations for each award category.
All right, thank you, Anne. Category C indicates students in medicine, suggesting pre-med students, but then the careers go on to describe prevention, behavioral health, and caring for older adults. Is category C only for medical students or all health-related professions?
Hovik, can you address that?
Yeah, I'm looking at it right now. The post-undergraduate.
Yeah.
Yeah. So that is. Yeah, I'm trying. Things I'm trying to remember all of it. So so the post-undergraduate, I mean, it's anyone that's either received a bachelor's and wants additional training. That would be that's category C. So it's offering fellowships to individuals to get more experience in health professions, whether it's at a clinic. So there's a list of the types of organizations that could apply for category C, which includes schools and as well as high schools. So it's really to create fellowships, and fellowships is defined loosely. So it's not like fellowship in the medical field, like undergraduate medical education or anything like that. It's very broad to ensure that we don't leave anyone out. So a lot of these questions, what we try to do with the program is keep it broad enough that we're not limiting anyone. So the main goal is, as long as you're creating an opportunity for individuals to get exposed to health professions careers in settings that obviously include healthcare. We try not to limit it, so we try not to be so specific that programs would just not be eligible. So something like post-undergraduate fellowship, it's open to anyone that wants to offer opportunities for students that just recently got a bachelor's level degree. I don't know if we define if community college is also included, but I think we do. But generally, it's to offer fellowships for those that might not have the opportunity to be exposed to health professions, but have relevant degrees, or want to kind of go into a new field and don't have the relevant degree, but they just need experience. It's really to expose those students.
All right, thank you, Hovik. Next question. Good morning. For the pipeline program, is the expectation to only facilitate entry into educational programs or actually complete the course to earn a state-recognized credential, which will allow the student to work as a healthcare professional?
The goal is to support students through the process, so it could be both.
Okay, thank you, Ann. In the grant guide budget template, there is no line items for personnel or staff to run, execute, manage the grant. It also specifically states that the grant funds cannot be used to supplement the salaries of existing full-time staff of the organization. How can we pay for this grant then, especially for the application that requires a minimum of 240 enrolled participants?
I will answer that question. My name is Clinton again. If you go through the application, there is actually a separate category for personnel, and there's an opportunity to place in there your compensation costs for like a program director or support staff over the program. But it is part of the application. It's under the category of personnel, which in the application we actually break it out separately from the actual budget items, because we need to know a little information about the people who are collecting this compensation. So it is a line item, but it's separated from the actual budget. You will see it in the application when you get in there, though. Hey, Chris, you're muted.
Thank you. Sorry about that. Does your organization have to be nonprofit in order to apply?
It's public and nonprofit.
All right, thank you. Can award categories C and D be applied to supporting students in a PhD program?
The intention of category C is for supporting students coming out from their undergraduate work. I think we would want to know more about the kind of PhD program you're discussing, because our goal here is to produce professionals who will provide direct services.
Okay. They email the question with more specific examples of that to hipcop at hci.ca.gov.
We will have
Do you want
to
them,
email you.
do you want them to email a more specific question as for the specific example? All right. Yeah. Go ahead and email and we'll be able to help with that. Mark Simon asks, for category A, what counts as serving, conducting outreach, or participating in an actual program?
I will need to do some research to answer your question, so please email us. Thank you.
All right. Richard asks, is this grant available to local public health departments?
It would depend on the category of program. So as you see, I'm looking at the list here. I think this is a hard one to answer. Let us do some, just have some discussions about that. I think our goal is to reach educational entities and training entities with this grant. So we'll follow up with you.
And I could add that the one category for sure is summer internships. Those public health agencies are eligible to participate in internships. So one of the things that potentially is there is forming a partnership. If a program is depending on the category they're selecting, it's within the guidelines to incorporate a public health agency as part of your pipeline or internship program and expose them to a health professions career at the public health setting. But ultimately, the goal of the program itself is to add providers into the direct patient, not direct care, but direct patient care. But that also means public health. So again, this is where we get back to the flexibility. If you have a program that incorporates a internship at a public health setting, then that's okay. That's an eligible setting. If it's solely only for public health, then that's where we have to say probably need a little more description on what you're proposing. But if it incorporates public health, then definitely, that's fine. It's if it's solely only public health, then you might have to, we have to kind of research that further. And I'm talking about things more like, if you're talking about like environmental sciences or things like that. But if it's public health related and it's in the health field, like a public health nurse, then that would be an area that I think we probably would be fine with, but we would probably need a little more description on if it's public health only proposal or it's just public health as a component of the larger proposal.
All right, thank you, Jove. Let's see, next question. Do the programs have to be 501c3?
I believe we've answered that question, yes, or public agency or university.
Can you please show the key date slides again? Awards notice, grants execution, grant start date, etc.
These will be published in the slide deck that it will be available after this webinar.
Can a student who is counted as part of the 240 minimum category A be supported for more than 1 year, or are they then excluded from being a part of the 240 in the subsequent year?
It's our expectation that we would hope you would serve new students, but there's nothing to preclude you from doing that as long as you can report the expanded activity in your annual reporting requirements. Clinton, do you want to weigh in here?
No, that's just about what I was gonna say. Because you're right, we would encourage you to do new students, but we haven't created any rules to stop that. So it would be our preference to do so, but maybe if maybe next year when if we do another cycle of this, we may end up reevaluating that. But thank you, Ann.
All right. Martha asks, can we get this recording? Martha, we will be posting this recording to our website in 7 to 10 business days, and we will email that recording out to all registered attendees of the webinar. All right, next question. When I go on the HCAI website to apply, it says the following: only program directors are allowed to initiate an HPPP application. To request to be a program director, please contact us at hipcop.hci.ca.gov. Any comments or?
Yeah, this Clinton, that is correct. When you go through the application and you apply, you must create a profile first. And then as part of the process, when you go through and finish creating your profile, we'll automatically be pinged for it. But we also ask that you follow up with an email and tell us that you want to be made a program director, because remember, it's not just program directors, but a program director can also get, if they have staff that are assisting them with the application, they can also get them included in the process. But you have to have a role established as a program director, and then you can add staff to support your application later. But the program director will have the authority to do so. So that is correct. You log on. If you're the program director, ask us for access and send us an email doing so, and then we'll upgrade your status. And then after that, you'll be able to add more staff if you are so inclined to help you with the application. Thank you.
Thank you for that clarification, Clinton. I see an allowable expense is financial support. Presumably this means we can provide direct student support, such as a stipend to students for participating.
Oops. Yes, that is a category in the budget.
All right, thank you, Ann. Would a CNA registered apprenticeship be eligible for category A?
Is it an academically linked apprenticeship program? I think, as Hovig was describing earlier, we would want it to be affiliated with an academic setting.
Thank you, Ann. We are a nonprofit mental health organization. Would we qualify for this grant?
No, you would not.
All right. I'm a for-profit registered healthcare apprenticeship program. Would I be eligible to apply?
We would look to see if you are affiliated with a public or private university, and might consider it in that context. Otherwise, as I've mentioned earlier, for-profit applicants are not eligible. And let me back up to the question about mental health organizations. If you are affiliating with a university or college, it may be possible that you could become part of a grant program. The trick will be having that institution submit an application.
All right, thank you, Ann, for both those clarifications. Lucy asks, can a group in the same department, for example, apply in a single application for different programs that fulfill multiple categories? For post-baccalaureate programs, category D, applying with an internship program that fulfills one of the other categories, for example.
Hello, this is Clinton. your organization is capable of applying for multiple programs, but you'll have to complete it. Like if you're going to do one for categories A and B, for example, you have to do one for category A and then come back and again and do another for category B. You will be linked together by the organization by your profile though, but we will need to see two separate applications, one completing the process for A and one completing the process for B. Thank you.
Thank you, Clinton. We received the award last year and want to augment its pathways, category A, as we are adding additional programming to strengthen its cultural and linguistic competence. How competitive would it be for us?
Well, this is Clinton again. Here, let me turn on my camera too. You'll be in the pool of people applying for the same thing. So I mean, it's not that it would reduce your standing. Okay, this is a new opportunity, and you'll be in a pool of people equal to them. If you already have an application last year and you're already serving people, the hope or expectation is that you're going to serve above and beyond what you're already doing for this last year. We don't want you applying and trying to ask for money for the same people though. If you're doing above and beyond, then that's what we'll be evaluating you for, and that's what we'd like to see on your application. If that's the case, then you'll be in even standing with any other applicant, and you'll be evaluated, and we will award based on your score or other considerations like your geographic representation as a possible consideration. But mostly it's the score. Hope that answers your questions.
Thank you, Clinton. Is San Diego, California one of the HPSA sites?
This is Clinton again. San Diego is a huge area, and I think that there might be some HPSA areas in San Diego, but I don't know if it's fair to say the entire area because it's huge. If you have a specific address, we do have a geolocator on the website. Or if you'd like, you can also send us the question and we can look it up for you too on if you send it to our HPCOP mailbox. But you have to give us a very specific address though, and we can evaluate it for a HPSA. I hope that helps.
All right, thank you. Let's see, it's a question asking for an email address that we can ask clarifying questions after the webinar. The email address is posted in the chat. It is also going to be on the last slide. It's hipcop@hci.ca.gov. Let's see, to determine if our organization is physically in a HPSA area, we need to use the data files on your website. Clinton, I believe you just spoke to the geolocator. Would we be able to post the link to that geolocator in the chat for people?
I just saw a post right now. I think Alma had already posted, if I'm not mistaken.
Okay, we'll double check and make sure that we get that posted in there. Let's see. There's a follow-on question for Anne. For part A and B, does this pipeline include master's students? Examples, MSW, MPH, MA, MS. It looks like we still had needed some clarification on that.
Yes, it could.
All right. Thank you, Anne. Sydney asks, I work with a Health Career Pathways Initiative in a rural HPSA area. We have educational projects from pre-K to the college level. Are we considered a health professional training program?
As you'll note, high school and school districts are eligible, particularly in category B. I think what if you're seeking to fund, it's certainly in pipeline as well. I think I would like to do some follow-up research to be sure of this and check with my colleague who normally supports this program to give you a complete answer.
All right, thank you. Our program addresses the priority health professions, i.e. behavioral health, nursing, but is not exclusive to the ones listed. Do we still qualify?
Hi, I'm reading your question. I believe, as Hovik sort of answered that question, that we're trying to be inclusive as opposed to exclusive. I see Hovik jumped on.
Yeah, so I know we listed categories on the grant guide, and I think we listed in here was primary care, behavioral health, caring for older adults, which is pretty broad, nursing, which is also broad, oral health, and allied health. I think allied health might be broad enough, but if it's something very specific that you don't feel is within those, I would say contact us, because we try to cover everything in those 7 categories. But again, what we think, what you're proposing, if there's a profession that doesn't seem to fit, we could take a look at it and say, well, you know, for us, I think that would be allied health, or it could be nursing, depending on the profession you're proposing. But if it's something outside of a health profession, more like I think this is where it probably gets a little more like public health, things like that. That's something that we probably need. You know, you can ask us directly, and we can assess, because that's very specific.
All right, thank you, Andrew Hovik. And I got a thumbs up on that. I believe that was helpful. Thank you. Fabian asks, are workforce boards eligible to apply?
In partnership with an eligible organization, they would be, yes.
Thank you, Anne. Our project director sets up an account to make an application. Can they add additional users to the account so that more than one person can work on the application? I believe that question was already answered by Clinton. And the answer is yes, right?
Yes, this is Clinton. Yes, that's correct. Once your authority has been established as the program director and you're able to log on and start applying for the application, you could go back to the profile and then add an additional user. And because you're already the program director, they will have to, anybody you ask to assist will have to create a profile themselves. But once they create a profile, you can use the drop down and go through the list, find their name, add them to your application, and then they'll be able to log in and out and make changes. Now, as the program director, though, they will not, if any staff that assists you will not be able to submit the application. That will be still your responsibility, but they can go in and make changes and corrections and fix things as you go. But ultimately, when it comes time to complete the assurances and certify, the program director must do that. The supporting staff cannot.
All right, thank you, Clinton, for that clarification on that. Can interns or fellows under category B or C funding receive grant funds in the form of a scholarship, paid internship, or stipend?
I'm just reviewing. Yes, in fact, if you look at slide 13, when you get the deck, you'll see that we say 5,000 per internship with a maximum of 20 under B. And then under C, we say 25,000 per fellowship. So yes, those are direct support for students. And how you know, these are fellowships, so you can define it, a fellowship as a scholarship, intern, or stipend. But the idea is to support, you know, the student directly or graduate. Yeah.
All right, thank you, Anne. If you're already awarded a grant in 2022, can we apply for another grant? Clinton, I believe you addressed this already, but anything else to add to it?
This is Clinton again. You're still eligible to. I'll just one more time. I'll go over it. You're still eligible to apply, but we're looking for above and beyond what you did in the previous year. So if you already applied, you should be making an attempt to ask for the same amount of students that you had reported before, above and beyond. So whatever, if you're adding more and doing more for this year, you can apply, but just for that. Okay. Thanks.
Thank you. Laura asks, if we apply for more than one category, do we submit separate budgets for each category?
This is Clinton again, and yes, because when you for each category you apply for, you'll be underneath the umbrella of the same profile, but you'll need to apply for one. You'll need to do one application for like a category A and another application for category B. And so as you do that, you'll have to go through and create a separate budget for that.
Thank you. Can you confirm that an eligible organization must be located in a HPPP? We are a large community college which serves rural communities, tribal lands, and HPPPs. However, our central office is not located in a HPPP.
I think you raise an important point, and what would be useful, and maybe Chris could weigh in here with regard to the scoring on HPPS. It's, first of all, they do not have to be in a HPPS to get designated HPPS in order to be funded. It's points that are earned toward in the scoring process of ranking applications. Chris, can you weigh in more here?
Yeah, and that is correct. With the HPPS, you can have your central office, but if you have program sites in various locations, each program site is evaluated.
All right, thank you, Ann and Chris. Sharon has a clarifying question on allied health. Let's see, I asked the question about the allied health definition, but should have asked specifically if it included the profession of pharmacy. Roles of pharmacists have expanded beyond traditional dispensing duties. Thank you.
Traditionally, pharmacists are not considered allied health because they have advanced degrees. We're looking for people at the very lowest entry level that are performing things that are traditionally certificated. Howick?
Yeah, yeah, because pharmacy is an advanced degree. I would say that would go under primary care.
All right, thank you. Let's see here. Next question. Stacy asks, hello, it doesn't indicate on the guide that organizations have to be nonprofit and public. Can you add that to the grant guidelines? So for for-profit organizations don't anticipate the ability to apply for the programs. And I see, okay. Less of a question there, so we'll move on. Will the recording be shared with us? Yes, the recording will be shared. We will be sending it out 7 to 10 business days via email. We will send you the link to that along with the slide deck and any other resources that are available at the time. Let's see, Brian asks, academic scholarship support is an allowed expense, correct?
Hello. Yes, it's a line item in the budget that Clinton reviewed earlier.
Thank you. For the 240 students indicated in category A, does this need to be reached at the end of the year one, or can that be a goal to reach in subsequent years? I work in a rural area.
Hello, this is Clinton again. When you go through it, we're asking about the amount of students that you're training per year, and so when you do your annual reporting, that's part of the deliverables that we are looking for. Is that in this case, if you say you're going to be able to train 240 for 1 year, then that would be the expectation, is that you're going to hit 240 before the conclusion of that year, and when you do your annual report. So that is the expectation. Yes.
All right, thank you. Do nonprofits providing prevention services for child abuse and direct mental health services qualify for the award category D post-baccalaureate scholarship?
So it would be students or graduates that are going into behavioral health field. That is the goal of the program.
All right, thank you, Ann. Okay, let's see, next question. I'm trying to understand where a high school career technical education program would apply. Category A requires 240 different students per funding year, so that is not going to work. Category B is internships and can also cover support for establishing more partnerships and work-based learning placements. Question mark. Category C says post-undergraduate fellowships, so that is after the bachelor's is earned. How does this apply to high school students? You answered earlier that category C could be for high school. Can you explain?
I said that in error. It is the pipeline program that we attempt to reach to high school students. And B is summer internships for high school students as well.
For a CNA registered apprenticeship, would training programs be approved through CDPH be considered academic?
Again, going back to the goal of the program, we're looking for people who are going to be providing direct services, not an academic career.
Could you please clarify that it is required that an organization has to serve 240 students to be eligible?
This is Clinton again. Yes, for category A, that is a requirement. So yes, it's a minimum.
All right, thank you. I am a for-profit registered healthcare apprenticeship program. Would I be eligible to apply if I have a fiscal sponsor with a 501c3 status?
Again, look in the grant guide as to what organizations are eligible to apply for these grants, and you would need to be aligned with one of them.
All right, similar question. If we're a for-profit health professions training program, are we eligible to apply for category A?
So I want to do some more research on the question of for-profits, and we will address that in a follow-up email.
All right. Continuing on the nonprofit theme, my organization is registered as a nonprofit with the Secretary of State, but I have not received the 501c3 status from the IRS yet. Can we apply now or should we wait?
When do you, well, if you could send us an email about this, because it will depend on when you anticipate you'll get your 501c3 letter, and we'll follow up.
All right. Let's see. Next question. Can you clarify about the ineligibility of nonprofit mental health organizations, even if we have a training program?
I'm sorry, I'm looking for the question. Can you read it again, Chris?
Yeah, the question is Julie's. It's, can you clarify about the ineligibility of nonprofit mental health organizations, even if we have a training program?
We are limiting applications to the organizations listed in the grant guide, and that is why we would encourage you to partner with one of those eligible organizations.
Okay. Can a nonprofit nursing organization apply for the grant?
I'm sorry, I'm having trouble catching up with the questions, so forgive me. What is the second part of that question, Chris?
Can a nonprofit nursing organization apply for the grant?
You would have to be an educational organization defined as a university or college, a health professions training program in order to apply. If not, again, we would encourage you to partner with such an organization.
This question, I think, is referring to the HPSA geolocator. What does the priority score mean on the geolocator information?
Chris, can you answer?
Absolutely, absolutely. So actually, I do not know the priority score. When you're looking at the geolocator, what we are looking for is if it says designated, or it'll say yes or no, and that's what we're looking for.
All right. Let's see. Can you explain a little bit about the reasoning and rationale for having participation in category A as having a minimum of 240 students each calendar year?
This is tied to the level of funding that's provided to support that number, because it's a $500,000 grant.
And this one's for you. Could you please clarify, HPPP grant guide states that for category A, the eligible entities are public and private universities and colleges. However, you stated that private post-secondary vocational schools are not eligible. We are a BPPE approved CNA school. For the above definition in the grant guide, it appears that we are eligible. Could you please clarify?
We will research your question and get back to you. I think you are correct, but I want to be sure before I say yes.
Let's see. Maria asks, the geolocator for my zip code in San Diego states the information on HPSA primary care, mental health, but nothing for dental health. Does this affect my eligibility to apply?
This is Chris. It does not. It's site specific.
If necessary, are you able to expand your program site locations once the award is funded?
Well, this is Clinton here. I'll take a stab at it. One of the problems is that we're looking for you'll be evaluated on your sites when you actually apply. And so if you happen to be awarded later, okay, we won't know about the site right off the hand. So if you happen to get a better site or align to a better site later on, it won't be part of your application, won't be part of your score, it won't impact your scoring. But if it helps you achieve your deliverables of training, however many students it is for whatever category you apply for, I would encourage you to do that, because as long as you're meeting the training requirements or deliverable requirements, then you're meeting your obligation towards the grant itself. It's good because it'll help you finish it, and we're okay with that, but it will not help you with the scoring or evaluation to becoming eligible for an award itself. It'll be afterward, but it's okay if you do it later. It won't help you with the score. Hope that answers your question.
Thank you for that clarification, Clinton. More clarification for Sydney. To clarify, I can only apply for category A if I'm able to train 240 students per year. What do you count for the training? Does experience and exposure to high school students count? How about exposures to students younger than high school?
I would refer you to the grant guide, and if you don't feel like you get a clear answer to this, please email us.
All right. Henley's looking for some clarification about CNA program. CNAs provide direct patient care. I believe this is referring to an earlier question about CNAs.
They would most definitely, CNAs, in fact, are a good example of allied health. So yes, they would be an eligible population. The question will be, is the organization eligible?
Thank you, Anne. Just to clarify, under category B and C, nonprofits cannot apply for this grant when partnering with universities as the site center for the behavioral health internships. Does the university need to apply and not the nonprofit?
That is correct. Yes. Unless for category C, if you're considered a health professions training program, then yes, you could apply. Actually, both of those, in both programs, you'd be eligible to apply. Yes. So I'm looking closely at your question, and you don't say what kind of nonprofit you are. Hovik, did you want to weigh in there?
Yeah, so I think it's different for each category. So category C is pretty straightforward. It's post-undergraduate. So it would be individuals that just recently graduated. If a program wants to offer fellowships, we would look for some kind of relationship with a school or university to have students that just recently graduated enter into that fellowship. For B, because that also the summer internships includes high schools, a separate entity that that fits those settings, and I think it's defined in I think it was the slides, but the grant guide. So we're talking about community health centers, again, public health departments, public behavioral health settings, institutions that care for older adults, and community-based settings. So in that case, because high school students are counted, this is where an organization wants to develop internships, and it could potentially be from one of those types of sites that's applying, or is in the larger kind of collaboration with other entities in that region. And this is where we are really stressing the one of the hopes for this program is to create kind of these collaborations between the school, between a potential facility, between a training program, and between the community, so they can support these individuals throughout the entire path. So with the summer internship, an organization could strictly only apply saying that they want to create summer internships, and they'd have to explain what kind of relationship they have, whether it's with high school or college, in bringing in those interns and how they're going to support them. So for B, yeah, it's a little more broad, where it can be an organization offering that internship, just needs to have a relationship with the high school or university. C, because it's post-undergraduate, it would be same thing. It would be a fellowship at a specific type of facility that's listed or setting, and we look for a relationship there with a school or university to offer that for their recently graduated students.
All right, Hovik, thank you for that clarification. Did you have more to add, Ann?
No, I wanted to clarify on information I provided earlier regarding category award category A and pipeline programs. I think I had indicated that high schools were eligible, and that was an error. We have a separate program that we will be launching in the future called Health Career Exploration Opportunities program, and that is traditionally aimed at high schools. And community organizations. So my apologies for that error.
All right, thank you for clarifying that, Ann. Speaking of clarification, Sydney's looking for a little bit more on the 240 minimum. I'm confused why the minimum is 240, but you expressed wanting to reach rural students in HPSAs. We have great programs, but not that kind of capacity. Can you please speak to this?
Oh, Clinton, yes, please.
No,
Yes.
I was just going to say that you had already answered the question in. Annie had answered this question earlier, and I'm sorry for the delay there. But basically, it's because we're going to give away $500,000. Okay, that's part of the reason that it was set as part of the terms of the grant for this run. Okay, so a lot of money here, and so we're looking to put some big numbers on the board. It's actually a good idea, though. It would be nice to be able to hit rural areas, but unfortunately, it's baked into the cake this round, and so maybe it's something we could think about for future work.
Hovik.
Yeah, I just wanted to add, because I mean, it is important for us to ensure that the rural communities have these programs and have access to them. So it's noted that that's a difficulty, getting 240 students in some rural communities. And one of the objectives we kind of considered when we were building this out is hoping for, again, I think kind of keep referencing a collaborative effort within communities. So we would strongly encourage rural communities to coordinate together and collaborate to help get to that 240 number, because I think it's very important for us to ensure that rural communities do get funding. And and if you look at this scoring criteria, we actually have additional points if you're in a rural community. So it's really important. So we really do encourage organizations to collaborate within these rural communities, and happy to, if you want to contact us, happy to try to help facilitate that as well. If you're looking for a partner in the rural community, we have our State Office of Rural Health in HCAI that can help get the word out. But we really, and there's other entities that are available to assist too. But we just really want to stress that rural is very important for us. So we're really happy to help. If you want to contact us to see how we can help you collaborate with other organizations and then potentially apply together.
Excellent. Thank you, Hovik. And I see in the chat we already have some collaborative connections happening, which is awesome. And please keep doing so. And as Hovik said, please reach out if you do need further help. Okay, well, it looks like we've reached the end of the questions. And we are also almost out of time for today's webinar. So thank you so much for all of your participation in the Q&A session. We do hope that you found it informative. A lot of great questions out there. If you still have questions, please email the team at hpcop@hci.ca.gov. As a reminder, we will post the recording of this webinar on our website in approximately 7 to 10 days. And we will be emailing out the slide deck along with that, the link to the slide deck and all of the other resources that we have available. Now I'm going to hand it back to Hovik, who will provide some closing thoughts as we come to the end of today's webinar.
Yes.
Alma, will you go to slide 25?
There we go.
Thank you.
So again, I wanted to thank everybody. We really appreciate it. Amazing questions. We have some homework to do, so appreciate everyone's dedication to asking these questions, because these are key questions that we need to address. It's not like one of the main points is the for-profit, nonprofit status. But hopefully we're able to answer most of your questions. Again, don't hesitate to contact us. So you have our contact info here, and just email us. We'll get back to you right away. We usually try to tell you, give us 24 hours, but please contact us. We'll respond. And if you need assistance, again, we've mentioned, you contact us there, and really want to focus and let everyone know that this is an amazing program. We're really excited about it, and we're hoping that those of you who are here on this call and others, that if you want to refer to them, let them know about this program. Join our mailing list so you can learn about our other programs. We do have programs. As many questions came through, there's a lot. I think a lot of us probably just be like, oh, we have a program for that. If you're interested, that might not fit here. So again, please contact us, join our mailing list, learn about our other programs. We do have other programs specifically that you folks were mentioning in here. But again, I want to thank you all. Appreciate it, and thanks to the staff for developing this and creating it and answering the questions. Really thank you all. And again, don't hesitate to contact us. Thank you.